have Jackie Balcom. Jackie holds a bachelor's degree in dental hygiene from Loyola University of New Orleans and a master's in education and guidance and counseling from the University of New Orleans in Louisiana. As we all know, she is the current president of the Michigan Dental Hygienists Association. Yay. In her career, Jackie spent 27 years in private practice dental hygiene, including 10 years as a business owner. For the last 8 years, Jackie has worked as the dental coordinator at the Muskegon County Health Department. In addition, she is an adjunct clinic professor right here at Grand Rapids Community College. Thank you very much. And she is a frequent guest speaker on dental public health programs. Please welcome Jackie Balcom as she enlightens us about many community dental health programs.
Cool. Very nice. Okay. Let's see. Do we we just need to find the next PowerPoint. Wow.
Is that it?
It is. Can we just go to slideshow? Great. Left. Thank you. Thanks, everybody. Thanks, Bunny, for inviting me. And as president of the Michigan Dental Hygienists Association, I would just like to say one thing, and that is these ladies who are presenting today are living the vision of the Michigan Dental Hygienists Association and being the voice of the Michigan Dental Hygienists. So please give them all a hand. I have a long background and a short background in public health, but public health has probably been the most fun thing that I've done, and the last thing so far in my career since 1972, so 35, 36 years, a long time. But it just seems like yesterday that I was a student like you all are sitting up there in the 5th row. I'm really happy that you're here to hear all of these ladies speak. I'm not going to speak on PA 161. I hope to become a PA 161 provider. I would like to work in WIC right across the hall from where I am at the Muskegon County Health Department. I'm a one-man band program, dental health promotion program at the Muskegon County Health Department. And I just want to give you a 2-minute brief synopsis of how I got that position. I had been in private practice for 20 or so years. I had my own business, Dental Hygiene Associates, in association with 2 dentists in Muskegon. And then there was a very important group called the Muskegon Oral Health Coalition, and they made a presentation to the Board of Commissioners, and they showed them some pictures, and the pictures were of baby bottle tooth decay. And in all my years of private practice, I had never seen baby bottle tooth decay. And the visuals that these commissioners got from this dental coalition was so compelling that they said, we cannot have this going on in Muskegon County. We have to address this problem with our children. And that is one of the pictures that really made them think, we have a problem in Muskegon County. So the first thing that, once I was hired, they did a search. I thought this is a really great opportunity to do something new and different and work in the community. The first thing we did was to address the problem of baby bottle tooth decay, and it was kind of a 3-prong approach. We created a community awareness program. We created a baby bottle tooth decay PowerPoint presentation to primary care providers and actually went into medical pediatric offices and talked to the pediatricians and talked to the staff and showed them this PowerPoint. We also gave them toothbrushes, brochures for the parents at all the strategic appointments, that the well baby appointments that newborns have on the way to the 3-year-old appointment. At that point in time, and this has just changed recently, but it was 3 years old that the dentists and the dental offices started seeing the children. And so after seeing some of these pictures, I think they were pretty instrumental too in making the change to the focus on the 1-year dental visit for 1-year-olds. And we have Dr. Phil Monroy coming the end of the month to Muskegon. He is a Muskegon pediatric dentist, and he'll be speaking on the 1-year-old visit and the change and the paradigm shift in thinking and the points of light. So I have like 15 more open slots for that seminar at the end of the month, and I've brought some flyers in case anybody's interested. I'll be sure to get them to you. And we also did new presentations to prenatal care classes, Head Start parents, and daycare providers. This was 8 years ago that we started this. I still take the baby bottle tooth decay information wherever I go, wherever I speak in town. I hand it out to parents whenever I speak to parents, whenever I create a program for first grade students to teach them about dental health and how to brush. I send home a care packet for the parents about baby bottle tooth decay and oral health for children. So these are the really compelling 4 slides, and I think I've got more about that later, individual ones to show you the pictures that really, really, really make a difference. And if you need copies of those, I can send you this PowerPoint also. So what we did when I started at the health department, started addressing the problem of early childhood caries, as you learn it in school and as it's called in the dental profession, but baby bottle tooth decay more when you work with the community, talking about the causes and the effects of this problem. What we wanted to do was we wanted to reduce baby bottle tooth decay by 75%, eliminate bottle feeding by 1 year of age, start children on 2 times a day daily toothbrushing, and decrease the operating room costs by 75%. So these are the pictures that I take whenever I talk to parents, whenever I talk to providers, and I just have some pictures that are like this size, and then we go over it and just tell them what it takes to get a baby that's in that shape back into shape. Full mouth extractions, lots of stainless steel crowns, lots of pain and suffering for the child. And how could a child that looks like that make friends? How can they be happy? How can they learn if they're in school? So we had a big job. Sheila has talked about statistics. This is another part of my job as the dental health coordinator at the Muskegon County Health Department. We needed to know where we stood. How much does it cost? What are all the costs associated with this? And then how can we tell if we're making a difference? So those were our initial costs 8 years ago. Total cost of seeing a baby bottle tooth decay case on the average was $3,605. So our goals were to reduce that. The 75% reduction in new baby bottle tooth decay cases would be a savings of $800,000 in local dental care costs. And then, of course, the intangibles of the reduction of pain, loss of function, medical implications, pain and suffering of the child. And some of the things that we did were education, handouts, reinforcement, and the identification of beginning decay and early intervention. Along with our presentations to dental offices and medical offices, we also went to Fluid which is an advertising agency in Muskegon County, paid them, worked together with them, another collaboration. And they helped us create these posters and postcards. And then later on, I wrote a grant to get pictures of that initial baby bottle tooth decay, the one with the black teeth on the front. And we made labels and we attached them to the posters and the postcards and laminated them. And I did bring some of those today if anybody's interested or has a place that, like a nursery, preschool, school, or a church nursery where you can put something like this up and get the parents' attention. So this was another part of the program, the posters, the postcards, and then the baby bottle with the drill bit, and the don't put your baby to bed with a bottle. We had this on Seaway Drive. We would have liked to have really expanded the program. We only had funds to run it during Children's Dental Health Month, February, so you can tell all the snow. But this was a very wonderful program that we did for about 4 years until the funding totally dried up with that. We also had radio ads, and I don't know if you can read the words to that, but it is, it was a radio spot, and it was sung to Rockabye Baby. So it went, rockabye baby, asleep in the bed, asleep with a bottle, looking well fed. But inside his mouth, the teeth are all black. They're falling out rotten and they're not coming back. And then a woman would seriously say, putting your baby to bed with a bottle is dangerous. The reason? Baby bottle tooth decay, a disease that quickly results in black, broken, and rotten teeth. It's caused by liquids, juice, milk, pop, even breast milk, staying on your child's teeth. You can prevent it. For all the facts and a free dental care kit, call the health department, and then our phone number. This is a bit of publicity that we had about the campaign. And then it just so happened that I had planned on going to the International Federation of Dental Hygiene Symposium. And when we created this campaign, I think this was the second year when we went into the community more so with it and combined all the phases of the baby bottle tooth decay campaign. And I got to speak to an international audience about this. I wrote an abstract, it got accepted, and then I made the presentation. And the really cool thing about international speaking is we get to speak in front of the World Health Organization and lots of international, globally minded and thinking individuals, and it's very exciting. And that's another picture of the bridge in Sydney. We have a website, Muskegon County Health Department website, and the dental health promotion site is one of the most popular, has some of the most hits per month, and you can go there just by hitting www.muskegonhealth.net, and then by program, the dental program is under educational services. Another thing that we do that we started right away, what had happened was I knew that the school fluoride program was funded by Delta Dental, or had been for 20 years, so we wanted to get on board with that right away. Unfortunately, Delta decided to put their money elsewhere, so the first year of our program didn't get funded, but we did have enough funds that first year in the budget to do it, and then we started charging. Now we're going to be charging $650 a child per year. Our costs are more like $750, but the health department absorbs the extra cost. This year we have about 1,059 children from 8 different schools. We checked with the DEQ. We did all of the background research with the water people to find out who had fluoride in the water and who didn't, because we are a fluoridated community, but there are many areas of our county that are in unfluoridated water areas. Whitehall, Ravenna, Montague, Holton, and a couple of areas closer into town. So this is actually a way to bring money into the health department or to break even with a program. We don't make a lot of extra money. These are some parent volunteers who have learned to mix the fluoride up and put it on the trays and bring it into the classrooms. We have consent forms first that the parents fill out and sign so that we can keep track of how many students. This was a little publicity that we had in Montague. We actually had a community-wide information series of talks with them because we wanted them to add fluoride to the water, but they did not want to add fluoride to the water. So we considered it a good educational outreach. And their mayor said, although we don't want to fluoridate the water so that everybody has to be medicated, we do really support the fluoride rinse program in the schools for the elementary students. So that's where we left it. These are some other features of the health department dental promotion program. Nursing home in-services, through doing those, I did learn, as you heard from Peggy, that dental health and dental services for the nursing home residents are about the last thing on the health aide's mind, getting that done. So we can be really instrumental in teaching them. You need to teach the teachers, teach the people who are going to be doing the services on the patients. So we go into the nursing homes and we actually teach the nurses and the nurses' aides how to take care of their own problems, how to take care of their own teeth, and then how to take care of the residents. We do put on continuing ed seminars for dental professionals. That's been going on for the last 5 years and has been a good way for us to bring funds into the health department programs. Head Start initiatives, Grand Rapids Community College student community dental health. We work with the students from GRCC here and Ferris, and we created a resource library where teachers and individuals in our community can ask to borrow typodonts, large toothbrushes, puppets, coloring pages, all of those videos are all available, not for rental, but just to borrow and then to return. And then we participate in a couple of really big community events. Give Kids a Smile Day and the mall event. Here's a GRCC student being a tooth fairy at one of our mall events. The mall event used to be in February, and then we had so many problems with Bozo getting snowed in and the students running off the roads and the blizzards that we changed it to the end of October. Here's Bozo and Dr. Connie Verhagen, one of our pediatric dentists in Muskegon. And that shows you the Lakes Mall and one of our events. We see about 200 children and a little bit older children. It's mainly focused on the young children. And the dentists come and they screen, the hygienists come and they educate. And we're looking at maybe making this into more of an event with fluoride varnish or sealants in the future. That's the whole dental hygiene group and Bozo. Now, Give Kids a Smile Day is originally a American Dental Association event where they wanted to bring a focus to all the underserved and how there are so many out there and what can we do. So this is what we did this year, and we did about twice as much as we've done the past 5 years. So it was just really amazing. We've pretty much got it down pat. Everybody who works are volunteer dental professionals. We target low-income, uninsured children, not children with Medicaid, not children with insurance, but children who don't have any insurance or Medicaid. And some years it's been tricky to get as many children as we needed. We've gone to radio, we've gone to flyers, and we work directly with the schools, with the MAISD in Muskegon, to get the information out to the parents and to the teachers. We have 2 FQHCs you've heard about, federally qualified health centers that are federally funded. I think they have some state funds also, but primarily federally funded. And so we have two clinics in Muskegon, and they switch locations every other year. Normally runs from 8:30 in the morning till 3 in the afternoon, 3:30, and normally we see about 68 children and have the equivalent of about $13 to $14 to $15,000 dollars that are the value of the services that are volunteered. This year we saw 128 children, and the value of the services donated were $28,000. So we're really, really proud and excited about that. Just some pictures. I get invited to participate in a lot of health fairs, and so I have learned to write to different companies. Biotine is very good in sending me products. I have to write them a letter on the letterhead and fax it to them, and they'll send me lots of supplies. The first year of my program, I had a lot of money to spend the first year, and they said, buy whatever you're gonna need for the next 10 years. So I bought like 7,000 toothbrushes, all different sizes, so I have lots of toothbrushes to give out. I get free samples of toothpaste, and so I'm able to donate a lot of supplies. This is 2 dental hygiene students and a diabetic health fair at Baker College that we went to many years ago, probably 7 years ago. And then just a little background on the continuing ed seminars for dental professionals. We do charge $55 for 4 CEs, $25 if you want to participate with no CEs. That includes a lot of the office staff. So we like to market to everybody in the dental office. We can bring in national speakers. We are having some local speakers also, but national speakers, usually you can find a national speaker who has his or her own sponsorship, so they do not charge, and all I have to pay for is the room. I have a room that's no charge, but the food, the room and the food usually are the fees that I have to pay. So it's a nice money maker for the dental health promotion program. One of the first things that I did when I took the position at the health department was I became a Academy of General Dentistry CE sponsor, but they got a little expensive, so now I go through the Board of Dentistry, and it's free to become a sponsor for continuing ed credits. This is Dr. Monroy's seminar, the end of this month. I just wanted to show you what the seminar flyers look like, and then there's a sign-up sheet that's attached to it, a registration form. And I work with Head Starts, various programs in Head Start. I would love to be able to do a fluoride grant PA 161 program with Head Start. We have a couple of concerns in that most of the Head Start kids are already patients of the 2 clinics. So it's not really a great opportunity in Head Start. Although we have 1,000 children participating in Head Start, most of them are at least getting their first dental visit, because we have an agreement in our community that all Head Start children can be seen at one of the 2 FQHC dental clinics. This is dental health resources for Muskegon County. Particularly, I found when Medicaid was not covering adults, we needed to get the information out to the community. Who will see you? We had a dentist, Dr. Felt, who would see Medicaid clients who were formerly had Medicaid but now didn't have any coverage, and he would see these formerly covered Medicaid adults and charge them what he used to get as reimbursement from Medicaid. So it was really important to let people know where they could get services, where they could particularly get emergency services taken care of. And as the others have talked about the importance of grant writing, these are some of the grants that I've written and received for various projects. Some of the first were Gerber and Howmet Corporation. They wanted to help with the baby bottle tooth decay campaign, keep that going. I wrote to Samuel Harris Foundation, that's of the American Dental Association, and got a $5,000 grant for putting together first grade totes and making dental health presentations to all the first graders. We did first Muskegon Heights because many of their elementary schools are at the 95 to 98% free and reduced lunch level, so you know that the need is really great. So we did that first, and then I wrote another grant to be able to go in and present to all the first graders of the Muskegon public school system. Then also we wrote a grant to Sheila's program, Michigan Department of Community Health, to review sealant programs in Muskegon, and that was a very interesting project. We worked with Hackley Community Care Center Dental Clinic. And we've received a couple of awards, which has been really exciting. National Association of Counties Award for the Baby Bottle Tooth Decay Community Awareness Campaign, the County of Muskegon Resolution for Baby Bottle Tooth Decay Community Awareness Campaign, and then we were a runner-up for Hackley Hospital Healthy Kids Award. And just so happens that my two sons have families in New Orleans, and that's where they were actually giving out the awards. So I had our award framed and then went to New Orleans on vacation to visit my kids and accept the award. So that was really fun. These are the professional associations that I participate in. The American Dental Hygienists Association and the Michigan Dental Hygienists Association, and then my local component society, Midwest. Also belong to the Muskegon Dental Coalition in my town, and through that, Give Kids a Smile Day Task Force. I do participate in various Head Start events, and I belong to the Michigan Oral Health Coalition and the Michigan Public Health Association Oral Health Division. And that's my contact information, and if anybody wants to know more information about public health on the local level in Muskegon, please just ask away at lunch or right now, or email me.